medical students there argued with me about giving me 10 units an hour of insulin plus 20 units as an immediate bolus. And I knew that at 15 and 125 pounds, that was way too much insulin for me. But because I don't have a medical background and I was just some teenager, they didn't take me seriously. And sure enough, 2 hours later, I was crashing and they were pumping me full of sugar to counteract all the insulin they just gave me.
My father's a diabetic with, bad coronary artery disease, who's gotten care at 3 different hospitals. When the folks at Hospital X don't know what happened at Hospital Y, they're not giving him really good care.
If your records are in Boston and you're in North Carolina or you're in California, there's no way to bring it all together.
You get subjected to multiple x-rays that you didn't need multiple of. There are exams that you needed, tests that you needed, things you needed to do that actually didn't happen because people didn't realize that that hadn't been done.
Not only does that mean that there's waste in terms of money and a burden on the healthcare system generally, it means my mom gets hurt. If I could snap my finger and have one thing transform the quality of care in the country, it would be that everyone would have an electronic health record that would be universally accessible.
And healthcare doctors and nurses, technicians, managers, they want to help patients, but they may find themselves in systems of work that just confound their best efforts.
With medicine, we feel like we have a responsibility and a bond to every patient who we care for. The problem is, with a paper chart sitting in front of you, it doesn't give you information that's up to date. It doesn't help you make connections. It doesn't help remind you of things that is buried in the chart.
The current system means that the information that's required is frozen in glaciers. So you need to go and chip it out of a glacier to find what you need to make good decisions. Our goal with this work is to have the information that's been delivered to your patient liquid, available, there when you need it so that you can make better decisions with your patient for their care.
Our health system has to change. And that it actually has to move toward one that actually coordinates care for a patient, one that actually understands what's going on with a patient or a population of patients.
It's about getting rid of the clipboard that you annoyingly have to fill out every time you go see even your own physician who should know you.
To collect information from multiple parts of the healthcare system, put it in one place that makes it easier for families to manage.
The record follows the patient, so when the provider sees the patient, they can see the total record.
It would put me in a safer situation as a patient. It would give me support and backup when I'm speaking with a physician or a new physician.
You've seen every other sector of the economy use information technology to drive massive improvements, efficiency, quality, service delivery. Healthcare hasn't yet had that opportunity.
It's almost a historic convergence right now, and maybe we can get the job done if we just really all do that together.
So the opportunity is better care, better health outcomes, better coordination of care, and with a lot reduced cost and improved efficiency.
If you have the ability to do something good now, why wait till later? Why not take advantage of this opportunity?
The Quick Response LifeScan System, the national gateway for medical records. In an emergency, how is your medical information going to help you if it can't be seen where you're at? With the Quick Response LifeScan System, the problem is solved. Using our app, a QR code scanner, or direct internet entry, a doctor, EMT, or other first responder has instant access to secure medical records. Our application pulls the user's profile while simultaneously adding to the user's information the location of QR code scan and hospital served by that ambulance provider. With a single QR LifeScan number, medical records are available instantly anywhere in the world. Simply enter a QR number and hit submit. Search is performed and medical records are available immediately. This is a sample of an emergency medical record. All data we store is encrypted using 256-bit encryption and 128-bit hash keys, and will utilize shifting keys for extra security. This is what it would look like if it were stolen. When the hospital creates the new patient's file or updates an existing profile, they need only add the patient's QR code to the file. If a tag is scanned in a hospital environment, their system performs a query for the QR code. If not found locally, they can then query our system for records. When querying our system for records, it will look at previous scans and will then query each registered hospital or doctor for records of that patient's QR code number. Our system will then encrypt, consolidate, and store records on a HIPAA-compliant server for future use. Our system then passes it on to the requesting hospital or doctor. All of this is done through a secure tunnel from server to server. This is an example of what the request would look like, going out to all registered doctors and hospitals by that QR code number for any medical information. Sadly, as of today, most medical facilities can't share information with each other. We have the solution for today, tomorrow, and the future. At Quick Response LifeScan, we've got the future under control. This is a demonstration of the Quick Response LifeScan emergency application. By simply opening the app and scanning a quick response code, it will instantly bring up a patient's information that you see here. It also allows the patient to put as little or as much information into this as they desire. It has insurance information, doctor information, as well as images such as a DNR or a baseline EKG. Automatically, it will be extracted onto this tab with the medications and emergency contacts that EMTs need. On the next screen, you will see the ability to record patient information such as the priority of the patient. They can voice record and manually enter blood pressure, pulse, temperature, blood glucose, and it will also connect automatically to a wireless blood pressure machine or thermometer or glucose system. It also allows the EMT to take voice memos. By doing this, it will automatically transcribe what the EMT says, put it in the box below where it says take notes. They can then save it. This is extremely time-saving for a paramedic. They will also be allowed to take picture memos below. This is useful on an accident scene if an EMT or a paramedic needs to be able to show the doctor in the emergency room exactly how the patient was positioned or what has happened to him. And down below, they can pick the hospital it's going to, send an email to the emergency room or to the doctors. It will also send an emergency text message notifying the emergency contact that this patient is being transported to that particular hospital.